Hello and welcome to Note to File, a clinical research podcast.
A collection of interviews, candid commentary, and general nonsense for the clinical research community.
Check us out at notetofilepodcast.com.
And now, without further ado, on to the show.
All right, hey guys, welcome to another Note to File. Denali, how's it going?
Good. I'm happy that we were able to sneak another one in the end of the year. Didn't know if we were going to be able to.
No, it worked out. I've been terribly sick for the last week, so if I cough incessantly into the microphone, sorry guys. Deal with it.
Tis the season.
That's right. I'm not editing it out, so deal with it. Today is National Bacon Day.
Ooh, I'm for that.
Yeah.
I'm a big fan of breakfast. Full stop. And like breakfast
Same.
meats is delicious. Big fan.
Yeah. Well, I mean, sausage or bacon though is a tough debate.
Oh, this is one that I am terribly indecisive when it comes to food in general. Like when it's like, oh, what do you want to eat? And you're like, I don't know. Like, what do I want? And so I feel like this is just like a microcosm of that conundrum that I face on a daily basis.
That's fair.
What about you? Sausage or bacon?
Happy New Year, Marta. Thank you.
Happy New Year.
I know there's a lot of sick people out there right now this time of year, so
I am 50-50 if I have strep right now. So
see, there you go. And you know what? We're here doing this podcast for you people. You know, that's just
dedication.
That's just how much. That's our gift. It's our gift to you. Okay. Today is also National Resolution Planning Day. So are you a New Year's resolutioner?
So I've actually been thinking a lot about this year particularly. I feel like in the past I've always done really like shallow and shitty resolutions where it's like I'm gonna get in shape or I'm gonna eat better. I'm gonna like all these like very like cliche and not very meaningful. But yeah, I've thought a lot about it this year. I think I'm gonna try to go against my innate grain and try to like be more like mindful and like mentally quiet and just sort of like meditative, which is
like
not my normal state. What about you?
Some thoughtful resolution.
Yeah. Going against my
I don't know. I'm I always like a blank slate, so to speak.
Okay.
A time to start over, try something new. I mean, it doesn't have to be at the beginning of the year. I know that's just kind of what people do, but I'm the same. It's not like I'm going to go to the gym. Nah, it's more, internal stuff. So yeah, I'm a fan. I'm a fan of anything that helps you try to do better,
It's funny though. I was at the gym yesterday with my kiddos and there was so many people touring the gym, like new people.
Oh yeah. What up, Nick? Happy New Year, man. Get back to work though.
So are you working this week? That's the question I have.
Yeah. All right. If you're in the comments, tell us if you're working.
Because I feel like this is like a dead zone of time. So Viva does a Viva break between like Christmas and New Year. And like, my Advar did the same thing. The startup I was at Haystack did not. My friend has like a weird thing where like you go back today and Tuesday, but hours are from like 10 to 2, but you still have to go in. So like it's an interesting mix of what folks are doing. But I feel like it's impossible to get work done.
Yeah, I feel like it's both. Okay. Happy New Year. Huzaifa probably screwed your name up terribly, but thank you. Gym traffic is going to go up 90% for like what, 2 weeks though? I mean,
I'd say like it's generally a good 3 weeks.
Drop off.
Right around like February. Well, people are like they're going to go. They go and like then Valentine's Day up until Valentine's Day, and then it drops off.
Marta is working and pretty productive without distractions. Good to hear.
Ooh, I like that.
Emerson also working, but expects most not to be around.
Well, I think that's actually a really good point. Like you can actually have time to do work as opposed to being like pulled in a million directions.
Yeah, we had a site selection visit yesterday, which I was kind of shocked by.
In person or remote?
It was remote, but okay. I think we had an in-person site selection like the week of Christmas, which was kind of surprising.
Yeah. Like this is more just like a dead zone weird time. That seems just rude.
True. Mitch, listening to sticky notes does count as work, honestly.
It's It's actually billable hours, so go ahead and count.
That's true. Yeah, I hope you're putting that on somebody. I hope you're invoicing someone for that.
It's our new funding model.
Alicia going back January 1st. You've taken 11 days off. Good for you.
Oh, that's awesome.
Good for you. Yeah, guys, take off. I mean, take it off. We all know this. I mean, this is a stressful, easily burnt out industry, I feel like. So, as much as I like give people a hard time, take all the time. Take all the time.
Just don't come back. Get in your car, keep driving.
You want to. It's hard, man. After that many days, you're like, shit, I don't want to fucking go back. Like, come on.
Well, I also feel like at some level, I don't know. I mean, I feel like it's just about vacation in general. Like if I take any meaningful amount of time off, I pay for it when I come back.
Yeah.
It's like either mentally, I'm just like, my brain is not functioning on the same wavelengths anymore. Or like stuff is piled up and it's just like, shit, I have so much to do on.
It's true. But yeah, I don't know. You get that. Nothing's ever done, really. So it's sort of like, don't worry about it.
Right. It's that, mentally being okay with it. Hence the New Year's resolution.
Yeah. Okay. Fair. Just be okay with it. There. You're cured.
You're cured. Done.
All right. Well, let's talk about some stuff, shall we?
Let's do it.
I'm certain that's why people watch, right? For our blistering insights.
Right. Up to the minute coverage.
That's right. Okay. We played with some of our settings here, so let's give it a shot. I saw this. It's been a couple of weeks, I guess, but Mass Gen announcing a new AI company, which I thought was kind of interesting. Announcing a spin out of AI with Care, a company founded by researchers from the health system who developed an artificial intelligence screening tool that significantly outperformed manual screening for determining a patient's eligibility and enrolling them in a clinical trial. This is new, right? This is not something we've ever heard of before.
So I think there's a couple of things in here which I think are fascinating. So like organizations to the scale of MGB often have some type of spin-off that's like an incubation division, like innovation incubation, like where they foster internal development where they think they can capitalize on it. So it's not surprising per se, and it makes sense especially for a recruitment company where like the whole success of your business is based on access to the data, and it's really difficult to sort of get access or attain access to this level of data with all the security and privacy structures in place. So like this specific type of innovation makes a lot of sense coming from the inside because it's fairly, it's a fairly well-known space. Like It's not, I feel like what you're doing in the space is not particular. Like I've yet to see a patient recruitment company doing something wildly innovative and differentiating from other people. Like you're looking at data, you're using AI through a number of different types of AI to curate it and pull those patients to the top. Like there's nothing like really robust happening in that space. So if you can do that and you have access to the data, you have it internally. Great tool, and it makes sense why you would do that internally.
Yep. Yeah. And I do want to point out that the name of the tool is RAG-enabled clinical trial infrastructure for inclusion exclusion review, otherwise known as Rectifier, which I think is a really cool metal band's name. Like we are Rectifier. And I might use that new band name. And again, nothing in here that's particularly like different than what we've seen from a lot of these companies. I still think the issue potentially, and curious to hear your thoughts. You probably know more about this than I do, but like, this is going to be tough to truly commercialize outside your own system because frankly, I've seen a lot of these. Some of them look great. I can't just like walk in and implement it within any system that I work. I know my models may be different than some, but not dissimilar from how many people provide clinical trial services. You know what I mean? So, they're not gonna let me walk into this huge instance of Epic and be like, hey, let me plug this shit into your system. And they're gonna be like, what?
Access all your
get out of here.
PHI and all your patient records. I mean, I think, that's going to be the huge challenge with commercializing anything. And there's actually been, I'm not going to name them specifically, but there's been companies who are patient recruitment companies that have spun out of networks that built their own thing. It worked well. And they're like, great, we're going to make money off this. It worked well. And they've not been able to successfully commercialize it. Yeah. And also the market space is pretty saturated in this space. Yeah. Exactly, Alicia. Right.
Shout out, Alicia. Yeah, I feel like there's probably
like there's so many AI tools who are doing iterations of creating different using OCR and NLP processing. They're creating knowledge graphs. They're creating different, but they're all basically the same thing, like maybe incrementally better than the others. And there's some that have shitty underlying tech and some that have really good technology that you can use, like word strings, and like there's different levels of sophistication you can have in these, but fundamentally they're all doing the same thing. So the market's not lacking for the space, and the success of these is the access to the data. It's not like there's been no tech that has been so significantly better that's like easily, yeah, we're going to hand over the keys. Here's the data, exactly to your point. We're like, and that's the issue where internally makes so much sense for them to do something like this because they can sort of have that access to the data. But I think commercializing something like this has been proven in the market to be challenging. And well, I don't think
you still run into a lot of the same sort of logistical problems as somebody who's has access to EMR records, and I can run ICD. I can run some sophisticated reports that they don't need AI. That are like native to the systems we work with. But
slice or dice or an Epic, whatever the hell it is.
Right? Yeah. Whatever's integrated within, and they're some are good, some are bad. It can be whatever. But at the end of the day, more of it, the bigger problem relies on like, does this patient give a shit at all just because they qualify on paper? Like, that's not really like that's great. It's a great thing to start with. And again, it's better to start there than with nothing. But then you're still going to have an extremely high rate of people who don't respond, have no interest. Why are you calling me? Hey, you're looking at my records. What the hell?
Mm-hmm.
Et cetera, et cetera.
I mean, that's exactly what we ran into at the recruitment company I worked for, right? Where like, even if you have the best tech, and honestly, the company I worked for had really, really cool, like actual technical infrastructure, and really, hey man, I don't work there anymore. I'm getting nothing from this. But they had super solid underlying tech, like some of the smartest engineers I've worked with in a long time, and they're phenomenal. And then you even have access to the data. So we had a couple successful like things where we'd have access to the data and we'd be able to do the thing. That's maybe half the battle. Like that gets you 50% of the way there. Now you know who the patients are, but you have to get access to the patients. You have to know if they're truly eligible, because you're basing your search on the medical record. Well, how thorough is someone's medical record? Have they been to everywhere? Have it been thoroughly communicated to other vendors and other healthcare providers? If they went to another clinic and had something else, did they take Ozempic from, hers.com? Like, there's a whole other thing. Like, it becomes, the data is not even complete. And then they have to be interested in the trial, and then they have to qualify at the screening thing. So like, there's so many things that you have to almost add like a services element to the business too. The tech is like a sliver of it.
Oh yeah.
And again, like that's why it's for groups like MGB, where like you have the team, they're doing it, they're doing all the manual search. This is a tool to help them, but commercializing that is a whole other ball of wax.
Yeah, I tend to agree. I think like it's great. It is useful, and I think it helps a lot. If you narrow that funnel. But yeah, it's really just a relatively small step towards actually getting patients in the door. But, it is what it is. And then it's not to like badmouth the thing, but I guess we keep seeing these like announcements that are like, it's great. It's going to do something or make a big impact. And I don't know. I guess it's hard to say.
Yeah, we say that because then we get our funding and we get our next round of funding because we say we're going to do the next big thing. I mean, it makes sense. There's need in the space. No one solved it. But then there's so many people who are unaware that like so many people are doing the same thing. They're like, this is what's going to change it. And it's like, you realize there's like 12 other vendors doing this.
Yep. Okay. And I'm sure we'll see more.
Yeah, I'm sure we will.
This other one I came up is a little bit older, but real time adding sort of an e-source to EDC component. Frankly, there's not really a lot of content to the article itself. But I think for me, I was more interested in sort of this becoming a more, another like sort of theme that we're seeing like in the space. I think Creo has what they call the centralized source, and real time is now, I guess, calling theirs EDC Connect. I've seen tools built by Metadata who are trying to sort of, work, how can they go out and pull data into the EDC? There's a number of different vendors out there kind of doing this now too.
And there's like independent vendors who do like just that fraction between. I mean, so fundamentally, I think this has been something that's been talked about for years in the industry, like connecting site and sponsor technology. And this is a piece of it, right? And sort of the focus now. I mean, full disclosure, like I think I have a biased stake in this.
Sure.
Because of my, working at Viva, and I think it does this makes sense, right? To do this, to connect these pieces. The place where I see the challenge and where I've seen challenges at other places I've worked is that if you don't have control over the full spectrum of site technology and sponsor technology, connecting the two becomes not necessarily a technical challenge, but a business and politically charged business challenge of doing it. And that's where it becomes really challenging. It's not the technological connectivity. I think most folks from an engineering side could easily kind of make that happen, but it becomes, how do we make this functionally work for both of our businesses across the landscape? And that's where I see the challenges for something like this arising, because real time does not have an EDC. So how are they making this? And then maintaining those technical integrations, if you don't maintain the level of like, you have to be in lockstep with the people you're working with as upgrades and releases happen to maintain these and make sure these don't fall down if someone upgrades, right? Like, you have to make sure. And then as more and more vendors come into the space, how do you maintain those across the board? That becomes a challenge as well. So I think the idea is great. I think everyone should focus on data sharing and connectivity. I think the HR space did that a while back with some legislation to force folks to share. I think our industry could benefit from something similar where we have like requirements and standards of sharing data. But I think it's going to be challenging until we have that for folks to do it, unless they own the full suite of it.
Yeah. I don't know. I will say, like, as a site, if I could go into my CTMS and there were already a build that connected to an EDC, that would be huge and great. Although I have heard some sites who don't, they seem to not like that. Like, they want their own thing, which I think is also can be problematic, and for reasons I don't fully understand. Frankly, as somebody who runs sites, I don't know why we think we need to be special.
Yeah, and I've heard that too, right? So I mean, like, I think if you think about like folks who have, for whatever, I mean, there was a woman I used to work with way back in the day and said, you've met a site, you've met one site,
right?
Like everyone has their own special snowflake. So like, I don't quite get it necessarily either, because you should be like, especially for something like this where like the data you're collecting, unless they want to collect other data as part of their eSource, that shouldn't go to the EDC, so they want it in addition. And
yeah, but I've never understood that either, because frankly, the whole reason I'm collecting the data is because the study requires that I collect the data. I don't really want any additional data if I don't need it. I don't need it. I need it because I need it because the protocol tells me I need it.
I wonder if there's a variation though in like a professional research site like yours, right? Where like you're conducting research versus someone who's like conducting research, like I'm a healthcare system and I'm doing research. I but then you put that in your EHR. I don't know why you do.
Yeah, I was going to say, I don't know what that would be. If you're going to use it for treatment, it needs to be done at a visit that's not a research visit and done for treatment. I think you start to blur the lines potentially there. But again, I'd be curious to hear from somebody like at a site who's
has that preference
against this. Yeah. Like more against this idea, and like what those reasons would be. And maybe that's something maybe a rabbit hole we can go down one of these days, but not today. I'm going to pull this guy over first.
Yeah, so this one came out right before Christmas. But AstraZeneca pulling a med based on some post-market fatalities that came up significant fatalities compared to control care arms, which I think is interesting for a couple of reasons. One, I think given we discussed a couple weeks ago the concept of like, we're moving towards deregulation, removing the need for, numbers of, phases, numbers of trials needed to run, like significant trials to run. And this was done in like a phase 3 confirmatory trial. It was cleared. And so like, if we're saying we need less regulation, this is happening now, what's the impact of reducing the needs of trials or to be run? You're on mute.
Sorry, better that than
hacking into the microphone.
Yeah, pretty much. Yeah, I think it is interesting. It's kind of hard a little bit for me to keep up with what the timelines were here, but I mean, this was approved on an accelerated basis in 2018 and was on the market. And then, I mean, it took until 2025 to have a confirmatory study in which 6 people died. I mean, it's 3 times as many that ends in the control cohort. You know, I guess these are thrombosis patients, so it's not completely unexpected. But that seems like a lot of, I mean, if it was out on the market for 7 years.
I mean, it'd be interesting to know when they started that phase 3 confirmatory study too. Does it say?
No.
Because I mean, like,
Yeah,
trials
if you go,
take
wow, there's a
fucking forever.
There's a clinicaltrials.gov link. Let's try it out.
Let's see what happens. I mean, because trials take forever to get up and running, right? So, like, even if they started it early.
It started in 2019.
Okay, so they started it pretty much probably as soon, quote unquote, as it was approved, like, 6 months to a year after. So by the time for people to like get the approvals done, large corporations, those things don't move quickly. So they started it probably.
And I think this is my argument for why I think people do try to be like, well, get it on the market, do a phase 4 trial. Well, cool, but except maybe people have been dying for the last 7 years.
And just taking it. Yeah.
And just taking it, but we didn't know. I don't know. That's interesting. And I feel like I'm seeing a lot more posts about sort of like, we need deregulation. We need it to be easier to get drugs approved, which, I mean, we want drugs to get approved more easily. Yes. But obviously the flip side of that is that, I mean, we don't know. We don't know what they're doing, until we've studied them appropriately. So I don't know what the answer is. And as with many things, the truth's often in between. Yeah. Maybe it doesn't need to take as long as it takes, but maybe we also don't need to just shove something on the market and then be like, yeah, we'll collect some data for a few years and see what happens.
Yeah. Well, it's just like, it's so interesting because there's obviously the drive to say like, hey, bring it to market. We're going to make money off of it. But then there's also the drive to let's bring it to market. There's not a great treatment out there. People are dying. Let's give them something.
It's true.
And have access to it. So there's sort of 2 sides to that. The thing about this though is like you're dealing with a population who has, fatalities as part of the diagnosis. Like, so like if they're dying and they're on it, don't necessarily, it's hard to pinpoint like, oh, is this being caused by their treatment? You wouldn't necessarily even know if you're not privy to like trials and things being tested and timelines and all of that. So you just sort of assume it's the natural progression of the disease. And so like picking up and finding those, I think is an interesting, like, I don't know.
Well, we'll see. I'm curious to see if we see more stuff like this happen with sort of dropping the requirement for confirmatory studies. Because, I don't know, it's hard to believe.
But if that's the case, right? If we did that, this particular drug would probably be living on in perpetuity and likely being at least partially the cause of a significant population of people's fatalities.
True. It's true. Crazy stuff.
What do you then like base it? Say like, hey, we're gonna wait until some doctor at an academic is like, I have an IIT idea to like study this because I think there might be a correlation, but we're not funding those people anymore, so they're not going to do it.
Right. Yeah, I don't know. It's a good question, and maybe dig a little bit deeper into this because I'd be curious. But you know what? They already made $219 million in 2024, so they got their money. They probably hopefully made their money back on their trials, and who cares? Mm-hmm. All right. Lastly, let's jump into what I think is the last article from our friend Dan Schell about interviewing some folks about predictions and whatnot for 2026.
Because tomorrow's New Year's Eve.
Oh yeah, you're right.
Mm-hmm. After run out and get some champagne today.
There you go. Okay, so let's see what we got.
What predictions do we have? How do we wrap up the group?
So let's see who we got. We got Barry Cowell, SVP, Head Development Operations and Portfolio Management of Regeneron. In 2026, the use of AI and digital tools will shift from experimentation to large-scale deployment, transforming how studies are designed and executed. The shift will lead to more efficient clinical research, accelerating the delivery of potential new medications to patients. Like, I don't know, this fits in with like some of the other predictions we've seen. I feel like, I don't know, man, people are really doubling down on this.
Well, I mean, it's kind of a safe prediction in my mind. Like, AI is coming. It's like, and it's going to be big. I don't know. Like, am I off base in thinking that? It's like what I would say, like, yeah, the internet's going to be really big. Like, it's like, yeah, of course it's going to be big. And of course it's going to cause efficiencies. Or do you disagree?
No, well, I don't know. I guess that's just it. I'm not confident enough to say that it's going to have any significant impact in the next 12 months, you know? I don't, and again, I'm not that tuned in and privy to like how AI is really being utilized, aside from people writing shitty LinkedIn posts with AI or making the fucking worst slop artwork I've ever seen. Or, you know, making videos and tricking people into thinking that they're real. So I'm not seeing it like happen, at least. I don't know, maybe that's the point. Maybe like it's not obvious. It's working. Maybe it's working so well that it's just not obvious to me how it's doing those things.
So I think I've seen a lot of it, like to your point, where like we're looking at it as far as like data analytics. We're looking at it as like content creation. I would love to see how it's being used on the pharma side, more specific, like how it's actually being used. Because I see like we're putting stuff out there. A lot of people are putting AI stuff out there, but like what is actually being adopted by pharma? That's something like I would be very interested in a meaningful way. Besides like, we use AI and we've deployed Gemini to this group of our sales team and this is the results we're seeing. Like that's the level of kind of thing. But I think there's some really cool potential similar to her projection or prediction for 2026 is like in like protocol design and some of that stuff, which I think could be really cool to see if it's actually done.
Well, we'll definitely see. Denise Bronner, shout out Denise. She was on our
a little over a year ago.
Yeah, or not this following year, but the year before that was in our dive team at ING. So shout out Denise. I kind of like hers. One is about the shift of trial data transparency. The first sponsor, I can't talk. First sponsor to systematically return meaningful trial data to participants, not just marketing summaries and legal disclaimers, will reset expectations for the entire industry. Patients are no longer passive participants, and you know, have to start explaining to people what the outcomes of these trials are. I like that.
What would be the impetus of that? Like, what would? Because like I think it's great in theory, but like, yeah, what's going to be the thing that actually makes that happen?
Yeah, I don't know. It's a good question. I don't know that there's a great reason why they would, because they've gotten away with not doing it for this long. Either way, I like it, and I hope that, you know, we continue to see a push for that. And then secondly, rising healthcare costs will fracture trial participation into two extremes. So rising costs will fundamentally reshape who can and cannot participate in clinical trials. Rather than a simple increase or decrease in participation, system will fracture. For some participants, financial instability, caregiving burdens, and competing survival priorities will suppress interest in research altogether. And for others, it will become a last resort pathway to care diagnostics or novel therapies. I feel like this is already kind of the case in some ways. We tend to see sort of like generally a certain type of person being a part of clinical trials. Now, it depends on that clinical trial and how chronic or acute the disease may be and how much it affects their lives. But I think we already see a little bit of a split in a way. You either have people who are sort of really need it and don't have a lot of other options, or people who are privileged enough to like not have to care about the time off work and can show up and be part of a trial, if that makes sense.
The altruistic research
correct,
participant
yeah.
versus the one who needs it because this is the only avenue to any care I may have.
Mhm.
Well, and I think you're right, but I think with her prediction, I think is spot on, because if you think about the changes coming with ACA, that's going to drastically change people's healthcare landscape and what they can and can't afford based on insurances. So
True.
I think if I'm following her prediction, I think we're probably going to see a uptick in that sort of latter group, the group who's searching for this for some type of care. Because you have millions of people who are going to fall off or can't afford healthcare anymore. Their healthcare is going to drastically reduce. So unfortunately, I don't love that, because I also think then it's like, then that turns into a, like, what is coercive? If this is your only access to care, you're not paying them, but you're giving them access to care. Like, and that's the only thing they have. Are they gonna, where's the line on that?
Yeah.
Which gets iffy, but I think I agree with that. Especially with the changes we see happen. I agree.
Yeah. Well, again, time will tell. Maybe we should come back to these, but
we should replay these episodes
halfway through next year. Or
we should do stitch our own videos.
Yeah, that's a good idea, actually. Lastly, we have Jim Cremidas, who's been on the podcast, executive director of AMRC. I like Jim. I think his prediction is pretty self-serving, if I'm being honest. In 2026, pharma will stop experimenting and start choosing who to build/partner with. Sponsors are facing rising costs, crowded pipelines, and an overload of point solution technology, forcing them to shift toward fewer, more strategic partners who can plan and not just place studies with. Multi-site clinical research companies are moving AI out of pilot mode and into core site operations, including feasibility, pre-screening, and monitoring. While consolidation accelerates across sites, CROs, and pharma itself, the winners will be the organizations that can reliably deliver speed, quality, and scale across multiple therapeutic areas. I wonder who those could possibly be.
I feel like it says it in there.
It does. And again, I mean, I get it, and I get that that's their whole thesis, and
Well, right, you're not going to go all in on something you don't believe has a future, right? Like, you're going to think that, ideally, right? It is. But yeah.
So we'll see. Obviously, there is still a lot of movement, in terms of M&A and private equity and blah, 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 blah.
I know some of the other predictions we said landed on that. I'm particularly interested in that. I just think that's a fascinating space in general, particularly in the healthcare delivery by association clinical research industry, to see how equity is going to continue to play in that space. So we didn't really see that today in these predictions. Those are sort of some of the previous weeks.
Yeah, I don't think we saw it as heavily as we have previously either. Like,
do you think that's because it's changing, or just no one really wants to touch it? Because
I don't know. It's a good question. I'm not sure. We'll see. Again, I tend to think that sites especially aren't necessarily good candidates for this sort of investment. But
I mean, I think healthcare delivery, which I know clinical care is an option, but you're providing some type of health care to a person, right? Like, I think there's a scalability that just doesn't work well.
Yeah.
Again,
I agree.
That.
We can go into that as if we don't almost every week anyway.
It's just, feel passionate about it. I'm not going to pretend I don't.
Any, I don't know, any predictions from you that you would make for 2026?
I really should have thought about this the past couple of weeks. And honestly, I haven't done as good of a job in thinking about what I actually think 2026 is going to look like. And I tend to be kind of a hole poker. So I feel like any prediction I'm going to come out with is going to be super depressing. So I don't know. What do you think?
Yeah, again, I've never been big on predictions. I tend to think it'll probably be generally more of the same with maybe some incremental improvements. I still think the AI question is going to be interesting. I think it's going to either come to be shown as a much bigger disappointment than what it's been made out to be, or maybe I'm totally wrong, and maybe the whole industry's changed. I think we're already seeing examples in other industries, though, of some companies sort of backtracking on their big AI visionary plans and be like, "Whoops, yeah, actually, maybe we were a little too ambitious when it came to what AI can do for us." If you look at was it Salesforce recently that we're like, whoopsies, maybe that wasn't quite what we want to do. We need to keep refining what that's going to look like.
I mean, a lot of people are like, oh, it's AI, we're going to do all these things without knowing what the hell AI actually is or isn't, or what the parameters of it are. So I think there's people who are not technical setting massive boardroom visions that didn't crack, right?
Sure.
I think it will probably become much more prominent and well adopted. I'm more of the camp. I think it will become much more embedded. I don't think it's necessarily to the extent that everyone believes, because I think there is still a human element to it, and also our industry is sort of like tied up in data. Like for AI to work well, it has to have good data, and I think we have a data and a diversity problem, and so like some of the issues of using AI is it perpetuates data problems and some of those pieces. So I think there's going to be some fundamental hiccups and challenges, but overall I think it's going to be something we come into. And then I also think, I tend to be kind of pessimistic about the impacts of what are thank you, Steve. For those who don't know, in the boardrooms, AI is artificial intelligence. Honestly, there are sometimes I've met people in boardrooms who I think don't actually maybe know that. But I also don't know. I think that the impact of the healthcare landscape is really going to have and like the funding landscape that we've seen like start this year are really going to snowball next year as far as like research funding and like access to healthcare.
Well,
and there's going to be some negative impacts on the space.
Stay tuned for my new AI rollout. I will be accepting everyone's money.
Well,
I'm gonna do it. Might as well get in on the grift while it's still hot.
I mean, if I told you my take on imposter syndrome, where it's like, so the whole idea is like, oh, I'm not good enough to do this, I shouldn't be doing this. But then you get into these rooms and spaces and you're like, well, no one knows what they're doing. Yeah. Everyone's just making it up. So if I'm gonna have imposter syndrome, might as well be an imposter and start making shit up to like get a piece of the puzzle, like a piece of the pie. Everyone's doing it.
You could be the best damn imposter you can be if you're gonna do it. It's not a bad.
Might as well actually be an imposter if you're gonna have imposter syndrome anyway.
It's true. All right. Well, anything else before we close out the year?
No, it's been a banger of a year.
Not too shabby. We'll start working on getting some guests booked out over the next couple of months. I've been derelict in my duties, so I'll work on that. So hopefully you guys will be seeing a bunch of stuff not scheduled the morning of, scheduled out a little further in advance.
So you do New Year's resolutions?
Yeah, see, New Year's resolution right there. Maybe I'll find it. Maybe AI can do it for me, So
there you go. We'll start a company.
There you
invest.
Go. It's done. All right, guys. Have a happy new year. Be safe. And that's all I got.
Well, see you next year.
Later.
Thanks for listening to Note to File. We're committed to continuing to bring you independent and unfiltered coverage of the clinical trial industry.
We want to talk about what you want to hear. So if you have something on your mind, hit us up at notetofilepodcast.com.